Up next, we have Heather Marie-Ogburn Stokes, who is the CEO and founder of Serenity Life Recovery, LLC. Heather will be sharing valuable insights on integrating wellness programs and self-care policies into healthcare systems. Her keynote speech is titled Implementing Wellness Programs and Self-Care Policies into Healthcare to Increase Productivity, Employee Retention, and improve patient outcome. This promises to inspire actionable strategies for creating healthier workplaces and better patient care. Please help me in welcoming Miss Heather to the stage.
Hi, everyone. My name is Heather Ogburn Stokes. I'm the founder and CEO of Serenity Life Recovery, and I just want to start by thanking you all and the 2.0 conference for having me be a keynote speaker and opening the conference with recovery and wellness. Implementing wellness programs and self-care policies into healthcare. So they didn't give me the clicker. There it is. So how do we increase productivity, employee retention, and overall improve patient outcomes? The objectives: explore evidence-based strategies to design and implement wellness programs that boost productivity while promoting a supportive and healthier work environment in healthcare settings. We all know that it can be very stressful and it's a constant state of crisis a lot of times in healthcare. Learn how integrating self-care policies can enhance employee retention and improve patient care quality, creating a sustainable and high-performing healthcare workforce. Let's try to remove the burnout, right? Let's look at the numbers. 30% of healthcare workers and first responders experience anxiety and depression due to constant crisis conditions and chronic stress. 40% of first responders develop PTSD. 25%, there was a 25% global increase after 2020. 1% of all suicides are healthcare and first responders. 46% increase in burnout and compassion fatigue. 55% ER nurses experience depressive symptoms, and 48% ER nurses experience burnout. So now let's create a safe, healthy, and compassionate environment. Integrate wellness programs as part of the staff benefits creates a supportive culture. Every time I go and meet a new hire, before that process, my team knows to ask the simple question, what do you do for self-care? We have to be well ourselves in order to be able to fully give. And we build it into our policies and our handbook so we can there's a level of accountability, right, and support. And it opens lines of trusted, compassionate communication. I don't know how many times I've encountered individuals or even nurses coming from ER saying, I just can't talk about that, right? I have to do what I need to do and it's patient-centered. I said, but how did that work out for you, right? You ended up leaving that job and you're bouncing from job to job, but what's feeding your soul, right? And she's like, I love being a nurse. That is who I am. It's like, but you're leaving each hospital or ER. What is it? It's like, I can't take the stress. So then I started thinking, well, if we're implementing wellness programs for our clients and our patients, why not implement it for our team, right? So the how, wellness holistic healing. Here's a few of the modalities that we offer for our clients, as well as our staff. Meditation, sound therapy, acupuncture, acudetox, massage therapy, compression therapy, exercise, yoga, and aromatherapy. So I encourage and empower our team members to experience all of these modalities. One, they can talk to the patients themselves saying, you're experiencing anxiety, this is how it worked for me, right? If they just got some bad news from home and they have to present and be focused at their work, they know that they can participate in any of these modalities to recenter and do a solid job for the clients. The why, benefits, right? Meditation, yoga, sound therapy, acupuncture, aromatherapy, and grounding all boost levels of dopamine, serotonin, and GABA. It provides healing and restoration of the sympathetic nervous system, reduces levels of cortisol, the stress hormone, right? Stimulates the parasympathetic nervous system, creating balance and regulation after stressful events.
Compression therapy, that is something new that we started incorporating because our wellness director found some great outcomes with the patients and said, let's schedule you to experience this, the team members. So they'll take their 5 minutes, 10-minute break, and then receive some of these services. So we've noticed that even our team, our recovery support services that are on the grounds constantly, right, they will go experience the compression therapy, and then it removes their pain in their legs and their feet, and they're able to be more active and more engaged with our clients. Exercise and movement, I think this is my favorite, stimulates dopamine and serotonin, decreases stress, and enhances memory, cognition, and improves mental health. I think my favorite fact is 1 year of regular exercise will increase the size of your hippocampus by 1%. That's learning, that's memory, right? And just think about the cognition improvements overall with the staff performance. Increased productivity and employee retention, cognition, concentration, and connection all improve. Creates a more positive outlook. Negativity is toxic. If they are constantly complaining or finding things to complain about, that is going to spread like wildfire, right? And then it just grabs to the next and the next, and then before you know it, the whole team is just negative. And it becomes just a job getting a paycheck, and then the patients are getting forgotten about. Increases resiliency to stress, promotes confidence, creates a healthy and happy culture, and decreases burnout. I know at our facility, the staff members that actually participate in our self-care modalities, they take less time off. They might take an hour to reset, but then they are more productive, right? The clients that they work with, it's a night and day difference between the ones that are struggling, and we will ask, hey, go take a mental health day, right? And this is our recommendations to get well. So the wellness shift, that's what I like to call it. The positive attraction, positive attitudes, positive energy promotes healing and a positive outlook. Your brain is a very powerful muscle, right? The more we think positive, the more we become positive. And what we say to ourselves and to others, that matters, right? If we are just focusing on whether it's a team member, an employee, or a patient, like, why aren't you listening? Why aren't you taking your medicine the way you should? Or why aren't you performing in the manner that I expect? That's all they're going to hear is what they're not doing well, right? But if we empower them and focus on their skills and lift them up, right? I tell the team, I just said, if you find something to complain about, right, I want to hear 3 positive things about that person and how to lift them up, right? Because energy matters, and the clients can tell, the patients. The passion ignites, becomes more than just a job. More engagement, right? The patient care improves because they feel heard. They feel that positive energy. And I've noticed that within our care center, right, if a nurse is having a difficult time, and maybe they might be the only one on the floor, and we have several admissions scheduled, we will send other team members in to support, right? And then that client's experience drastically improves. They are more likely to continue care and not try to leave AMA, right? The purpose and meaning of life, breaking old cycles, trauma wounds. This goes with team members as well as our patients. right? If we're not able to recognize our own triggers, our own trauma wounds, and even the stress of being, if it's a ER, right, or first responder, there's trauma involved there. And if we're not able to recognize that, then we're not getting well ourselves, and it just radiates negativity. So everything is connected. The individual, the environment, the behaviors, his or her thoughts, his or her sickness, and his or her recovery. Mind, body, and spirit. It matters what we receive and who we are around in the environment. So wellness at Serenity Light Recovery. This is our beautiful campus. It's nice and serene and such a beautiful atmosphere for individuals to come and receive true healing, right? So we are a recovery wellness center that specializes in addiction and behavioral health treatment. It's a beautiful blend between Eastern and Western medical modalities. We are known for high medical treatment as well as implementing true wellness programs into our treatment plans. Very customized, very individualized. And so the clients can come in without judgment, without criticism, just be them and experience all these different modalities that even our team members have experienced, that can share their experience and empower them to try it out themselves. And they are really building they're really building upon their recovery maintenance program. That's what I like to say. And we are all recovering from something, right? Whether it be stress, whether it be trauma, whether it be maybe substances or food, whatever it may be, right? But we are recovering, and wellness is for everyone. Using the same modalities for client care as well as the team self-care, integrated self-care requirements into the team handbook. We notice that if it's not in writing, they're probably not going to want to do it until we can inspire and encourage to do it. But it also holds a level of accountability. So the way we do it is we have specialized, licensed, and certified team members providing this care to the clients. And so they will actually schedule self-care time for our team members. So when they can sign up, and when they take the 30 minutes or the 15-minute break or whatever they may be for lunch, they will sign up for these services, get to experience, get recharged, and then have a very productive afternoon. My shawl doesn't want to stay up. Okay. So here's some pictures. Here's some of the team, right? We do the Acu Detox, Ice Plunge. We have Brain Tap, Biosound, Eye Assist. It's microcurrent neurofeedback. We do massage therapy, stretch therapy. Your body holds trauma. Your body holds stress. So just imagine being able to get that knot out of your back or your neck that you haven't been able to get out in years. And the breakthroughs that we see. And this is actually a picture of first responders and veterans that came to our facility to experience wellness. So those nurses and the first responders that I started out talking about, they end up coming to see us to receive treatment because they end up finding a substance to self-medicate. And it doesn't have to be like that. We can provide wellness and self-care modalities for our individuals, for our team. And I believe that it's the team that really makes a difference. We're heart-centered, we are passionate individuals that know wellness through and through. And so we are able to be that light and be that hope for others. And we inspire, right? And I would say inspiration is the greatest buy-in. It's the ultimate buy-in, right? So this is me. Serenity Light Recovery is a dream come true. It became my mission in life because I too, I'm a person in long-term recovery. And I never would imagine my life changing so much from the experience I endured, but what recovery and wellness brings. People do recover. People do deserve wellness, and we can implement it into our systems and to increase patient outcomes. The patients that we see that actually get involved in the wellness modalities, build it into their new lifestyles, into their discharge planning, and continue that journey. They are working at other treatment centers. They are now yoga therapists. They are thriving in life, right? And the ones that end up coming back and saying, what happened? Well, did you participate in your wellness plan? Did you participate in these suggestions? And no, I didn't, right? So what are you going to do differently? And it's just like talking to the diabetic that still wants to eat their cake, right? How do we change that mindset? And it's retraining the brain and giving them a life worth living, right? And that passionate purpose behind it. I keep looking back. I feel like there's more on there. But I know that we can make a big shift in healthcare. I know that we can implement more wellness into our treatment plans, into our care plans, implementing it into hospitals, right? You have the physical therapists coming in, and why not a yoga therapist? Why not have a meditation, practitioner come in and offer those services? Because the outcomes and their lifestyles will drastically improve, and there's so many studies showing that, and with nutrition, and I heard the panel, and there's so much, and I think that the key is collaboration and connection, right? Talking to each other and seeing how we connect. What can I offer to you and be a resource for you, but in turn be a resource together, because everyone's different, right? We need to be able to truly customize and individualize care for our patients and for overall outcomes in the world, really. We need to raise that bar of standard care. So I'll leave some of the remaining time for some questions. If you have any questions about specifically, implementing it into clinics, into hospitals, into treatment centers, and whatever else you may have questions for. Does anybody have any questions? Yeah? Okay. So we are an addiction treatment center. We have full medical detox. We see a lot of fentanyl use and opiates, and even just prescribed medication that has gotten carried away. So they come and receive medical detox, but we are known for the high medicals. So a lot of them are now in kidney failure, liver failure. They came from ICU. They have untreated diabetes or Hep C, right? And so that there's a more uptick of fentanyl use and mental health severity. A lot of even our marijuana patients, there's a higher level of mental health adverse effects that we've seen that needs further stabilization. And with alcohol use, the detox seems to be extended because of the higher rates of use. As far as our clinical work, our clinical director is actually here. And I'm sure she would love to be able to share some of the specifics on our clinical care. There's a lot more trauma. As I mentioned, we're seeing more veterans and actually NFL players, a lot of the athletes that have been scared to even say that they have issues or concerns because they're going to lose their career. They're going to lose their identity. It is who they are, right? And now we are working closely with those foundations, and they are being empowered to speak up, right? So there's an array of clientele that we see, but it's the I don't want to say the high profile, but the ones that have been suffering in silence because they have to perform and they don't want the stigma attached, right? So, yeah. Mm-hmm. Yes. So I would say recently it'd probably be around 20%. There's a lot of nurses. We've had a few doctors. We've had several that are in the industry of addiction industry. The other facilities that are in Texas, so we're in Texas, they actually send their employees to us or their family members. And it's really sad to see them, relapse because they give so much to others, right? And they focus so much on caring for others and giving and giving and giving, and they forget about themselves. We don't need to forget about ourselves. We have to stand strong, right? And to be able to be our full, authentic, greatest self, to be able to give fully. So.
That's a bit loud. I'm very interested in the way such systems can be implemented into the workplace. I remember when I first heard about the Hawthorne experiment, where they found that a good portion of what actually made employees happier was just the fact that the employer cared. Yeah. And so the question I have is kind of the reverse of that. Do we need to be careful about the way we introduce such systems so that it seems genuine? You might introduce some sort of a support mechanism or something like that and meditation and things like that. But if the employer says, right, you've got your meditation, I want to see the 20% improvement in production tomorrow. I'm exaggerating, of course, but is that the kind of thing that we need to be careful of, that we implement this in a genuine manner?
Yes. Yes. So I mentioned in the handbook, right, saying self-care is important. Don't forget about yourself, right? Then it really helps that we offer all the modalities for our clients, and then empowering them, saying, how are you going to encourage these individuals that probably are saying, no, that's not for me, right? To experience it if you haven't experienced it yourself. So I won't ask anybody to try something unless I've tried it myself, and I can come from an authentic self, right? The authentic experience, and saying this is how it's helped me and worked with me. When staff come to me and saying this is what's going on, even if it's at home or maybe frustration with a client that keeps changing what they want for discharge or whatever it may be, I have an open door policy. I build in that trust, right? The trusted communication. And then I will just gently recommend before you come in on your shift, right? It's not about work, but go ahead and experience BioSound. Take 15 minutes for you. You're worth it. And just reset and recharge, right? Because that's the only way we can be our best self and to be the best for others. And so it is in that gentle way. I see the increase in productivity. I don't have to measure it from that aspect, right? But I see results over time. And then within other measurements, it's not just focused on, you meditated, I want this, So, yeah. Yes.
Hi.
Hi.
My name is Dr. Omar Musa. I'm clinical researcher at Harvard, Boston. I had a specific question about how you personalize the treatment, as we all know is very important, of course, in the multidisciplinary care. From the moment that someone comes in and you do the intake, how does his personalized needs actually reflect in the treatment you make happen during your sessions?
Yes. So, we all have certain regulations, right, depending on the state and the level of care. So we have to be mindful of staying within those regs, but there's a way to create schedules and team members that are specifically assigned to those individuals to meet those needs, right? We have recovery coaches, recovery coach professionals that are on the team. Upon admission, they will be introduced, they will be assigned to a good fit, right? And having that conversation, even on the admission calls, getting to know that patient and getting the team prepped and ready if time allows. Sometimes they call within an hour, they're in, right? And then we get to know the client, especially during detox. If there's only so much visceral and propranolol you can give them, right? Without going into the narcotics and things. And so when we implement the wellness aspect, we are teaching them right then. And so we're meeting them where they're at, seeing what works, and then we can carry that on throughout the rest of their care, whether it be essential oils, the bath soaks and detox. We do the meditation and the massage therapy. So we see what they're drawn to and what is actually improving for anxiety and depression. And then we will continue recommending it. And then the clinical team will make their assessments and build a very specific treatment plan accordingly. We don't want to just write the same treatment plan, right, across the board. And the classes, right, we have standard classes, but they're in phases. So once they get out of detox, the awakening phase, or the renewal phase, then they transition to the waking phase. So the level of the education really meets them where they're at, and it's evolving with them. And then the individualized care comes with the wellness modalities that are scheduled in, the specific enhanced. We have a trigger awareness program we call SCARS, and so we will customize different trips or experiential therapy based on their needs. And then for some of the other specific trauma awareness classes, they're very individualized per person to have their own experience. And so it takes a lot of team members, right, and authentic, passionate team members to have that time, to have that open conversation with them and be willing and open-minded to shift, right, just a little bit. Think outside the box. That's not working, right? And so what can we bring to the table to work? Even having a team intervention with the patient, the client, and sitting down with them saying, this is what we're noticing, right? And what can we do? How can we be of service to you? Because this is what we're working with, and this is some of the things that we're noticing, and let them have a voice in it, right? And holding them accountable, because sometimes it's irrational thought, and so we have to keep that in mind. And then we bring them down and saying, okay, now we're thinking a little bit clearer, right? And how can we be of service to you in this moment and build that in? Help them have a voice, and it's the power of weighted choices too. So you give them some choices. Either way, you have the outcome that you're looking for, but you're empowering them to make that choice, that positive choice for them. And so they start removing those earmuffs and those blinders.
Exactly. Yeah, that sounds like a beautiful direction, like in consultancy, of course, as an MD or other caregiver. It sounds very dynamic, and that is, of course, how you should treat care. So great to hear. Have a great company. Thanks for your talk.
Yes, thank you. Thank you.
This is very high. Hello, good morning. How are you?
Hello, good.
Thank you for your informative. Thank you very much for your presentations. It was really informative. And for me, you can say it's just more of a comment. I'm Dr. Sahar. I worked before in the ICU in the emergency, and now I'm working in the post-acute rehabilitations. I can say mental well-being and the well-being of the staff is a must, and it should be implemented in each health sector. And now really, I'm thinking I'm working on a project to implement this in the Middle East because, you know, in the workplace, the staff cannot approach, cannot talk, cannot discuss because this has a cultural background and because of our society. Like, for example, the manager of a hospital will not come approach the staff and say, let's work on you and let's have your problem be solved. Because, you know, the manager, they will think like, for example, if I need a staff to work with me, he has to be flexible and he has to know how to overcome stress. Okay. Now I'm giving lectures about stress management in the hospitals, but I do believe from my experience that it's a must. You cannot, even for the patient and for the staff and for every single person, mental health and mental well-being is a must.
Yes.
Okay. And I can tell you one story before. I was working in Saudi Arabia and I was in the ICU. So one nurse, she was about to make a mistake, like a fatal mistake, but I was able to discover that early. Then when I asked her what's going on, why this happened, Then suddenly she collapsed. She started to shout and she was crying and she fell down on the ground. And I told myself, why don't we approach that stuff before this happens? Because this will affect the outcome of our patient. Thank you very much for your presentation.
Thank you. Thank you.
So, yeah, this is a very relevant session, Heather. This is Dr. Priyanka. And as Dr. Saha told that there are medical fraternity itself is suffering from this and you have brought this. So my query is that how you are assessing the wellness for the medical fraternity who is already in the field where they are in regular diagnostics and everything, how we come to know that what kind of exactly mental, physical and which particular area we require the wellness.
I think all of it.
So what is the assessment criteria you follow in your Serenity?
Right. So what we look for in team members from the very first interview, right? How do they handle stress, right? And then we ask the simple questions. What do you do for self-care? If they answer kind of off, then they don't really know or implement self-care into their lifestyles. So then we will encourage and ask them, are you willing to experience some of these modalities? Because this is what we teach for the clients, right? Or the patients. And then we look at really, their history and their experience. For those that are in recovery, we typically require 2 years because they have a sustainable coping, right, a recovery program. But even I've seen, individuals with 10 years in recovery and just kind of, not really taking care of themselves, right? No. And so there's a night and day difference. And it takes motivational interviewing. It takes those open-ended questions during the interview or during the evaluations and check-ins to really see where they're at. And I ask them, I'll pull them in my office, how are you? How is this affecting this, right? Because we can see the behavior starting to change, and then we see the community and the clients start to misbehave and try to test their limits, right? And then that's why I said negativity is toxic, right? And you got to stop the bleeding. And so it's really, I don't have a set number, right, or way of that, but we're going to incorporate personality, right, tests and looking at different ways, right? And I recently read a book that talks about, are you an early riser? Are you a night person, right? And talking about sleep habits. And that originated way back in the day for survival, because if we were all sleeping at the same time or we went to sleep at the same time, then who's protecting the family, right? And so I thought that was a very interesting fact because they said, why doesn't the workplace accommodate for that, right? If you are an early riser and you are more productive, right, 5 a.m. or whatever it may be, then your schedule should adjust to that. And if you are more productive in the evening, then accommodate that way. And so we look at that based on their shifts, right? And we have, 24 hours care. So we pay attention to those behaviors and we just start asking more questions.
Sure. So I will expect that if you are collating some data which is prior to they coming to the center and in all the dimensions of wellness, which includes the physical, social, emotional, even the financial wellness. So I think we can further speak on this part.
Yes, so with the patients and the clients, that's a different measurement, right? Because we're able to do a full assessment, pre-assessment prior to entering, and then upon admission, we do another assessment, and then we're measuring throughout, right? And that's what the clinical team does. And I recently was approached yesterday by a scientist, and they're doing clinical trials and brain scans, and so we're going to start incorporating that into the treatment so they can receive these measurements, the clients themselves, right, upon admission
through detox, let's go again, right? And you see the improvement. You see the healing happening, right? And when you participate in, let's say, meditation, yoga, even ISS, and after 30 days, let's scan again and let's show you. And so they're going to see the results right there. And
That's awesome.
sometimes it's hard to feel it themselves. I know others can notice a difference in me before I can notice it, right? And so we just need that encouraging data. And I'll never forget, when I first heard 1 out of 10 make it. That's hard. That's hard to hear, especially if you're going through it. I'm grateful that I was stubborn or persistent in that time and saying, I'm gonna make it. I can recover, right? And this is how. And this is how I'm going to improve life. And this is my mission to be able to share that message with others. You don't have to take that negative data, right, and have it discourage you, but you can be empowered and learn more about the positive outcomes, right?
Yeah. Awesome.
Yeah.
Look forward.
Thank you. Thank you.
Hi, this is going to be the last question. I'm Mudita Arora. I'm a registered dietitian and nutritionist in US. I would like to know if you incorporate medical nutrition therapy in your services, and if you do, are you looking for, do you look for some special certifications like eating disorder?
Yes, so we actually have a registered dietitian, nutritionist there, and she's on contract, so she'll come provide education once a month for the clients. She'll design specific meal planning and medical assessments with the medical team and certain dietary, requirements. We were just talking on the flight over, right, is how do we implement that more? Because nutrition is such a big piece. Right? We have them clearing out the snack pantry because they probably haven't eaten in a while. And it's just cereals. It's like, no, we can do better, right? We have it. We always have fresh fruit. But we notice that they will tend to, if you have sugar available, they'll go for it, right? And so how do we change the mindset? And that's just having it available for them. So our nutritionist actually specializes in eating disorders. And so we're able to monitor and manage because we've seen that it goes hand in hand, right? So I think that's very important, but also the medical side, because we do get a lot of diabetics or even recently liver failure, right, and cirrhosis, and being very mindful of her diet and having to teach, right, because they just want to eat, and then it's like, my life has changed, it's forever changed. It's like, you don't have to look at it in the negative, right, view. Right? Yeah. This is a new life, and this is how it's going to improve and thrive, and teach them the good in it. But education and awareness is key.
I agree.
Yeah.
Thank you so much.
Yes, thank you. Thank you, everyone. It's been a pleasure.